Hello, my name's Laura Manning. I'm one of the lymphedema specialist occupational therapists working here at Alchemy in Motion. Today, I just wanted to give you a brief overview of what treatment modalities I can offer and also a bit of my background and qualifications. So, as a lymphedema occupational therapist, we have specialist training to treat the swelling associated with axillary node dissections, inguinal lymph node dissections, and the unfortunate side effects from adjuvant treatments such as chemotherapy and radiotherapy. We also see patients who haven't had cancer. They might have a primary lymphedema, so that's something that has been inherited. And also some patients who have been affected by lipodema. They might have a lymphatic component to their lipodema. And also the vascular population. Some patients may come to me with venous insufficiencies or post deep vein thrombus. So going back to the lymphedema, most patients that we see coming through the clinic may have had breast cancer surgery, and what we can offer is an early risk screening program, which is best practice in the evidence. So we use a special unit which is not invasive and it doesn't hurt. It's called a lymphedema index or a bioimpedance. And that really gives me an excellent idea about the amount of swelling. If it is in a limb, that's either in the leg or in the arm, depending on the type of surgery. And we now routinely screen every 3 months so that we can detect that up to 6 months before a patient would ever come in with symptoms of aching or heaviness associated with their lymphedema. I also see patients who have undergone neck dissections, so that's head and neck surgery, and those who may have had gynecological surgeries. So some of the treatment modalities that we would offer are the low-level laser unit. That helps to improve lymph transport, soften scars, and improve the overall outcome of the lymphatic system when it's been interrupted through surgery or treatment. We also see, or I also treat cording or axillary web syndrome that can be associated mostly with our breast cancer population. We look at really good range of movement and breathing techniques, especially if the chest wall has been affected through radiotherapy. Looking at deep fascial adhesions, which can also occur through radiotherapy, and scar tissue. We use negative pressure, so that's trying to get a lift off that scar tissue. And of course, lymphatic drainage massage. I love to teach my patients or their family members to do their lymphatic drainage at home. Sometimes we prescribe a really efficient compression pump that can be rented, and that can do some of the hard work for you. Other treatments, we may need to look at compression, so that's compression garments. I can provide custom-made complex compression garments or just a simple off-the-shelf ready-to-wear garment, so if you're off flying and you need it for your risk reduction. If unfortunately treatment has led to an episode of infection such as cellulitis that's caused a seroma or more scar tissue, then we would look at compression management for that and some inserts. And also really good education to prevent another recurrence of that cellulitis infection. Other treatments, kinesiotaping, lymphatic taping, and also not forgetting the importance of exercise prescription. So I teach the Strength After Breast Cancer exercise program, which is evidence-based for lymphedema to prevent and treat lymphedema. So just a little bit of a background about myself. My undergraduate was in exercise physiology, and then I did a Master's of Occupational Therapy at Sydney University. I went to work in London initially as an occupational therapist. I worked in Sydney as well and moved up to the Sunshine Coast over 3 years ago. I also hold a public appointment at the Sunshine Coast University Hospital in the specialty area of lymphedema and vascular. I'm really passionate about what I do. I would be more than happy for patients to give me a quick call if they've got any questions before they come in for treatment. And of course touching base throughout treatment. So I look forward to meeting you. Come in, have a chat, and any questions I hope to answer. Thanks a lot.